Live.
All right. Well, welcome to Fertility Factor Fiction. We'll give everybody a minute to sign on. I have had an insanely busy day. They moved my OR day around. Oh, and that reminds me, I'm on call for gynecology. So if it rings, we got a problem.
Dr. T is on the call.
We got a problem because it'll be on TikTok. So
we will have to break TikTok.
I don't know how we're managing that one. It was just super busy today. I was in the operating room. Some very difficult, challenging cases with some very, very big cysts, but they all went well. Just took a lot longer than I expected, and then I had to do a cesarean section, and here I am. We are ready to do another show. I do have a topic coming up. There is going to be a review of two things we previously said probably are things you can look at. And on one case, we said you should do it. And in the other case, we said you shouldn't. And I'm actually flipping my decision on both of those. But they'll be coming up soon. I will have that ready for you hopefully next week. And then December 6th, and this is news to Tarek, we have to move the show because we have to do something else on that evening. So I won't be able to do the show that night, but otherwise we'll try. That looks really funny.
At least they can hear you.
You can't. It doesn't. Is it right, left? Oh, yeah, it's right, left. It'll still work.
Still works. You're good.
Yeah. Cool. So welcome, everyone. Happy to have you all here. And we're just going to go straight to questions. And we did put out 2 new videos. One on date fruit, which is really interesting. So I'm hoping that one will kind of go viral. I never would have believed it, but someone told us that dates actually help improve your labor. And I was like, there's no way that dates improve your labor. Sure enough, it's true. So it looks like that's important and worth checking out. So check that video out on our YouTube channel. And then our endo protocol is available too. I just had a call from a doctor in California yesterday who wanted to know what our endo protocol was. So as I was driving back from clinic, I was sharing that. Yeah, pretty cool. So if you guys have any questions or interest in that kind of thing, let us know. But check out those new videos on our YouTube channel. It's just Dr. Victory on YouTube. You got questions going already?
Yep. Is it possible to ovulate if my period is every 5 to 7 weeks? My ovulation strips are always negative. How do I help myself to ovulate?
Yeah, so that's like Fertility 101. So is it possible to ovulate? Sure, it's always possible. Is it likely you're ovulating if your periods are 5 to 7 weeks? No. How do you make yourself ovulate? Well, most people will turn to medical treatment, and that would be letrozole or Clomid, and letrozole is the first line agent. There are natural things you can try. So weight loss will often help. In addition to weight loss, you can try NAC, inositol, resveratrol, coenzyme Q10, and ALA. All of those can help a little bit. And then synergistically, in some patients, metformin will help as well. But we typically use it with letrozole or with Clomid. So those are the options for trying naturally. If weight gain or body mass index is a concern, bringing your weight down can help. And in a significant percentage of patients, they will actually start spontaneously ovulating when their weight comes back down to normal.
Hi, Dr. Victory. In T, elevated uterine NK cells and thin lining. When to start vaginal Viagra and how much?
So we use 25 milligrams 4 times a day, and we normally just start it with your progesterone, or like a week before you're going to do your embryo transfer. You don't need it hugely before, so that's what we typically do.
What should progesterone levels be going into an FET?
So in Canadian units, 40 to 100 unless you have endo, and then you want it around 150. In American units, that's 10 to 30 or 45. What you looking for?
I'm just trying to see. I just thought somebody wrote something, but nothing's written so far. Okay, I'm just good. Can using HCG help now to a man trying to impregnate his wife? Does it help when it's not 90 days earlier? And what can I do now to improve my fertility at this time as much as I can?
We have a great video on our YouTube channel. HCG will not help you immediately. It takes months for the HCG to kick in. And it, generally speaking, only works under specific circumstances. In particular, if the hormones from your brain are not delivering enough signal to tell the ovaries the testicles to make sperm. So that's a good instance where you would use it. There are some guys with weak sperm that will respond as well to the medications we use for women, FSH, like Gonal-F, Recadval, Menopur, all of that stuff. And you can test guys for a hormone called 17-hydroxyprogesterone, and it'll help you gauge how well they will do in response to the stimulation from those meds. But overall, the things you want to do are ejaculate frequently, so every day or every 2 days. Make sure you are not smoking, drinking, or using any drugs, and on top of that, maintain a healthy diet and exercise. So low cholesterol, low sugar, low inflammatory diet. Make sure that you are taking fertility vitamins. They can often help in cases where there's high levels of oxidative damage. And then lastly, keep your testicles cold. So we tell guys to sit on frozen peas for 20 minutes every day, and the cooling of the testis helps it work better. So that's something to consider as well.
From Instagram,
Yeah.
how can I get my hair dyed 2 months before an FET, and how about fillers and Botox?
Botox I probably wouldn't, and fillers I definitely wouldn't. Hair dye 2 months before would be fine. That would be okay. Just don't do it once you're pregnant or very close to your FET.
Is it normal to get a heavy period 2 weeks after second Lupron injection?
No. Not at all. Usually if you've done one Lupron injection and then you're doing another one, so I'm assuming you're doing the 3.75 dose, by the second injection you shouldn't be getting a period usually. So that's a little bit unusual, and certainly not a heavy one.
I've had a previous miscarriage 8 months ago. This
sorry.
past weekend I had a positive pregnancy test.
Oh, great. Congratulations.
My question is, would I be a good candidate for progesterone this time? Unfortunate blighted ovum last time, and I'm taking a baby aspirin a day.
Yeah, I mean, it's not unreasonable to take progesterone. The studies are equivocal as to whether or not it works or not, but I believe they're all hampered by the fact that none of them started on time. If you're going to start it, you want to start it kind of as soon as you have made the embryo or the day after. So like 2 days after your ovulation predictor stick shows that you're positive. If you're starting it much after that, we really don't know what the benefit or the advantage of progesterone is. And if it's significantly after that, like when you're 6 weeks or 5 weeks or something, there are actually good studies showing that it is not beneficial. So hard to know in individual cases, but overall, it does not appear that progesterone will prevent a miscarriage if you start it late. Having said that, progesterone with aspirin or with steroids or with other things, nobody knows for sure.
Possible reasons for low progesterone.
Bad egg quality, lack of ovulation, hormonal issues, anything like that could do it.
Is estrogen at level 75 normal for a day 3 blood test?
It depends on the units, but it could be, yeah.
What is your wait time for new patients?
It depends. We triage everything. So, if there's an urgent case, when we get a cancer case, I'll call them the same day. And we can get them into treatment immediately. If it's, I'm 33 and we've been trying for 2 years and it's not working, obviously those patients are still critical and important, and we value all of our patients, but we will talk to you about the options of, do you see me first, or do you see one of my colleagues like my nurse practitioner or Dr. Mayrand first. So we have different options for you just to get you in quicker. And if you want to see me, that's great. But it does take a little bit longer to get in to see me. But usually within a couple of months, we get everybody in.
What? Oh, yep, yep. Okay, because the question I asked last time, it was spaced out. It was, hi, Dr. V. I have a large, simple cyst.
Okay.
6 centimeters.
Oh, yeah.
From the previous retrieval.
Okay.
Is it okay to proceed with FET if the cyst is not producing hormones?
It is, but if it stays in the pregnancy, it has a risk of torsion because it's over 5 centimeters. Torsion is when it causes the ovary to flip over, and that's a surgical emergency, and then you're getting surgery while you're potentially pregnant. So we would want ideally to avoid it, but it's possible. Like, you can definitely do it. We just try to avoid it. To all our friends on TikTok, feel free to ask questions if you have any questions. We are here to answer your questions for anything fertility, OB, or GYN related.
How would you schedule your 39-week induction for PTS? Obviously, you're not always on call on the exact day your patients reach 39 weeks.
Yeah, I mean, for me, it's not critical that my patients all deliver with me. We just arrange for our patients to be induced. So I trust all of my colleagues. They're all excellent. And so we talk to you about what your desires are, what kind of timing you want. And if I'm not on during that week, then we just put you on with one of my colleagues that you feel comfortable with.
Egg retrieval before or after endometriosis surgery? I have endometriomas on both ovaries.
Well, that gets sticky. If you have endometriomas, it can be really difficult to do a safe egg retrieval. So depending on how big they are, where the eggs are in relation to the endometriomas, sometimes before, sometimes after. But as a general rule, your IVF stim is going to make your endo worse. So you want to do your stim first, then do your surgery before you do your embryo transfer. Because if you do your stim after you've done your endo surgery, you're actually re-stimulating the endo, and that's not a great idea, obviously. So we try to avoid that where we can.
Does it help if me and my wife have sex the day around her ovulation 3 times a day, or is it better to do it 1 time a day? Does it help to have more sex, or it doesn't matter if it's more than once a day?
Yeah, it doesn't really help, actually. You're probably, for lack of better expression, firing blanks at that point. So it's great fun, and I'm glad that you have an active, intimate life, but it's probably not productive from the standpoint of helping you get a higher chance of pregnancy. So once a day or once every other day is the appropriate frequency for conception. 2 or 3 times a day, I mean, if the mood strikes you, great, but you're actually decreasing your sperm supply at that point, so don't do that. At least not regularly.
From TikTok.
Tarek looks disappointed with that.
With the answer. I thought it deserves congrats. What are the most essential vitamins you should be taking every day?
A prenatal vitamin, a good prenatal vitamin that has folic acid, calcium, your B's, hopefully some D in it. You want to take vitamin D because almost everybody is deficient. Iron, if you're iron deficient, and an omega-3, and then we strongly encourage everyone to take melatonin as well. It increases your chances of success. Those are the basics. People with PCO, endo, they need other supplements, but the basics for everybody, we put everybody on those ones.
Great question. Not that questions aren't great, but this one I enjoy a little bit.
Yeah.
Is embryo grading at different clinics comparable?
No. So different clinics use different embryo grading systems. So for example, one popular clinic in Toronto does embryo grading, and they use a completely different system from anything I'm used to at any other clinic. The one we use is pretty common, so typically we see other clinics using our system, but it does vary from clinic to clinic. So the one in Toronto, it's actually opposite, so it's very confusing because their they have a scoring system from 1 to 3, and 1 is the best and 3 is the worst. Whereas for us, a 1 is horrible, a 3 is okay, a 4 is really good, a 5 is amazing, and a 6 is great coming out of a thaw, but not going into a freeze. So, the numbers are actually reversed. So it can get kind of confusing and difficult to figure out what to do with.
I'm 41, AMH4. I had 2 miscarriages this year. Get good fertilization rate, retrieve around 15.
Ooh, with an AMH of 4?
AMH of 4, yeah.
Okay.
Hard to get blastocysts. Should I do PGTA? My previous testing was aneuploid. Should keep transferring untested or risk transferring nothing? This will be my 6th round.
Wow. I'm a proponent of PGTA for women in their 40s, so my answer would be yes, you should do PGTA. 6th round, I mean, I'd want to talk to you. We don't typically do that many rounds for patients because I feel it starts getting unethical at some point. So we would want to talk to you and see what they've done for you, how they've done it. Sometimes we find the protocols that they're using are not optimal. So if they can optimize your protocol, that's a different story, but just doing the same thing over and over again does not make a lot of sense. But I would definitely encourage you to do PGTA. It does kind of depend on what your ultimate goal is. If it doesn't matter whether or not you're successful, you're just going to keep trying till it works, PGTA is probably not all that useful for you. But if you would use the PGTA to guide your decision-making process, like, okay, I'm not getting any normal, maybe I should consider stopping, or adoption, or egg donor egg, or whatever the case is, well, then you need it, so it'll help to guide your decision process. So I am a proponent of it, and I think the data is definitely there for women over 38. So I would suggest it is beneficial in that age group. Yeah.
Much love from Munich. Thank you so much for everything you do.
Oh, very nice.
Hi, Dr. V&T. Thank you for all you do. Please, do you have any egg retrieval protocols for endo patients?
Egg retrieval protocols, we tend to keep your estrogen levels reasonable. There are studies that show that sirolimus or tacrolimus ahead of time can be beneficial. We just did that show a couple of weeks ago. What was that, about 3-4 weeks ago? That can be really beneficial. There's a study that shows that Vizan being used for 3 months prior to egg retrieval will increase your chances. So there are some different things you can use. We certainly put our patients on the supplements to help with endo, but the stimulation part of IVF for endo is less critical than the FET part, in my opinion. So we focus a lot on the frozen embryo transfer protocol. As far as the getting of the eggs part of it is concerned, it doesn't really matter that much if there's endo there or not.
Can you start IVF transfer the first period after a DNC?
Yep, you can. Some people would argue it's even better because of the fact that the lining is regenerating and it's being scratched, so it's stickier. So yeah, you certainly can. If there's no concerns about infection, it's fine to go ahead.
Estrogen deficiencies and spotting before period. Doc wants to take me estrogen gel before and while taking letrozole. Counterproductive?
The doc wants her to take estrogen while taking letrozole? I mean, it depends on what it's for. It could be counterproductive if you have endo, but if you don't have endo, then if you need a little bit of estrogen to balance things out, it's fine. And the letrozole will keep your estrogen levels lower than they otherwise would get to. So yeah, that's not an unreasonable thing to do. We do that in our FETs when we're doing the letrozole protocol, but the patient's lining isn't thickening enough. We give them a smidgen of estrogen.
Is letrozole protocol counterproductive to having an estrogen deficiency? Same question.
Is letrozole protocol counterproductive if you have an estrogen deficiency? Not necessarily, because it depends on why you have an estrogen deficiency. So I would need to know the specifics of your case. I mean, if you're menopausal, yes, it's not going to help you. If you are not menopausal, then no, it very likely could help you because it can force you to make one or two eggs. So that drives the production of estrogen.
Dr. TV, going forward with donor eggs.
Okay, cool.
I don't ovulate on my own nor get true periods anymore.
Okay.
Is this a concern with donor eggs, or are these two issues okay?
Yeah, that's fine. It's not a problem at all. We have lots of menopausal women, young and old, that use donor eggs, and it's not a problem at all. So that's perfectly fine. Not an issue.
Is it bad to be on birth control for more than 10 years?
You should watch our new birth control video. That didn't do as well as I thought it was going to do. I thought that would be a smash. We have a great video on YouTube. Mm-hmm. Is it on YouTube or is it just on TikTok?
It's just on TikTok because it was a short. It was a short one.
Or Instagram or one of those.
Yeah, it's on TikTok, Instagram.
Yeah, so we have a really great video on the risks of birth control. We should get that on YouTube. So birth control pill does actually appear to increase your risks of breast cancer if you use it for a very long time. Very specific type of breast cancer. It's not a very high level, but that's probably the only risk. There aren't a lot of other ones.
Egg retrieval before or after endometriosis?
You asked me that.
Okay. Do you recommend starting FET cycle after a failed transfer or wait the cycle before starting?
Oh, it doesn't matter. You can start an FET after a failed cycle. It won't make any difference at all. There's no reason to wait. You can go back to back. It's not a problem.
My estrogen was 10,000, my last FET.
Oh, I saw that one, yeah.
I know this is extremely high.
Yeah.
What number do you like to see estrogen at during an FET for endo?
We don't normally monitor your estrogen levels that carefully because every woman responds differently, but that is definitely high. We try to avoid it. I can't say it's always avoidable, but generally speaking, we try very hard to avoid high estrogen levels like that. We reviewed a study about 2 years ago that said that you needed a minimum of 100. And as long as it was over 100, you were fine. I mean, everybody's over 100. So we're aiming for kind of roughly right around those levels, like in the low hundreds. But I mean, everybody's different. And sometimes you get 1,000 or 1,500. And otherwise you get 150, 200. And those are perfectly fine. So we don't pay too much attention to that. Admittedly, with our letrozole protocol, most of our patients are not getting super high estrogen levels. Certainly, if you have endo and your estrogen is 2,000, your endo is on fire, that's something I don't think makes a lot of sense.
Are you more prone to miscarriages after 2 births over 35 years?
You are more prone to miscarriages after 35 years, but the births don't make a difference. You're still at an increased risk of having more miscarriages if you've had, if age goes up, regardless of whether you have or have not had babies before. I hope that was the answer to the question.
I don't think I asked this, but if I did, I apologize.
Okay.
Is low sperm motility the only reason for infertility for men? If that is all that comes up in testing, we just brought a fertility cup. Do you think this will work?
Just bought a fertility cup?
Fertile lily cup.
I have no idea what a fertile lily cup is. Low sperm motility is not the only reason. So you can have low sperm count. You can have low sperm motility. You can have high viscosity. You can have low sperm speed. You can have a high percentage of abnormal sperm, and then you can have DNA damage. And then there's a whole host of other things, genetic problems and oxidative stress and things like that. So no, it's not just about motility. I am not familiar with the fertility lily cup.
Yep.
I'm assuming it's some sort of cup you cover your cervix with after, or you put the ejaculate in there and you shove it in to hold it in place. I don't know. I have no familiarity with that, but no, that likely wouldn't help. The challenge is always that it has to get through the cervix. So viscosity, motility, count, morphology, all of those things impact the likelihood the sperm will get through the cervix. Just because you've trapped it at the cervix doesn't mean it's getting through.
With MTHFR gene, should I avoid eating things with folic acid? Or
No.
should I just take methylfolate? Or both?
Yeah, just take methylfolate and don't avoid eating things with folic acid. It's fine.
What can I do to unblock tubes and avoid going through IVF?
Well, there's only one thing you can do to, well, I guess there's two things you can do to unblock tubes. One is surgery, to go in there and look and see what's wrong and fix it. And then the other is an interventional radiology procedure where they do it like they're doing a hysterosalpingogram. So they flush dye into your tube or into your uterus and watch it go into the tube. And then when they know which side is blocked, they take this wire with a little ball on the tip of it, and then they kind of feed that up through the dye and then follow the path of your tube, and they literally try and use that ball and the wire to bust through whatever is blocking your tube. It doesn't work very well and it is painful, but it can work. Studies showed anywhere from about a 20 to a 40% success rate, but the reocclusion rate is very high, and you're still at risk for an ectopic pregnancy. But it is a reasonable approach, and we have done it before for patients that couldn't afford to do tubal reversals or IVF, or didn't have the ability to go through surgery or whatever. So I have sent patients for it. In fact, I have one I just saw yesterday that is a good candidate for it. So once in a while we'll still do that if you have someone good in interventional radiology that knows how to do it. Otherwise it's surgery.
Hashimoto's and AMH of 0.1. Chances for IVF success.
I can never tell anybody what their chances of success are because I need to know the sperm, I need to know your age, I need to know everything about you. But an AMH of 0.1 is very low. So you're looking at a relatively low chance of success with IVF, unfortunately. Sorry about that.
At what age do women typically go into menopause?
Average age of menopause in North America is 51.
Do you only deliver our baby if you're on call or induce us?
Both. So I deliver all the babies that come in when I'm on call. I'm on call tomorrow. And if it's a patient of mine that is due for induction for whatever reason, then I'll induce my patient ideally when I'm on call, if that's possible. But as I mentioned earlier in the show, if I'm not on call and you need to be induced, then we set you up with one of my colleagues.
Options out there to suppress diaphragmatic endo?
Oh, diaphragmatic endo? Yeah.
Diaphragmatic endo?
Yeah.
Other than birth control?
Oh, yeah, sure. Vizan or Alyssa, which is Elagolix, Depo-Lupron, Depo-Provera, although that drug is evil. You could use surgery. There are a variety of medications, but there's lots that'll suppress it much better than birth control pill would. So Lupron, Elagolix, Vizan would probably be your top three choices.
My ACH is 13.6. Do you know why it would be so high?
ACH?
ASH? I don't know. It's written ACH.
I need you to tell me what you mean by ACH.
With a positive Receptiva DX test, would you recommend laparoscopic surgery or hormone suppression? Dr. Victory, I believe the question is for you.
The doctor I was speaking to last night was telling me that they had done an ERA test and then wanted me to base the protocol that I was using off of the ERA test and was actually arguing that we should adjust it. And I said it's a 13% decrease in success. They still believe in it. It's really funny. Receptiva DX does not work. It's been proven not to work, so I don't pay any attention to that. If you have symptoms of endo, you should have surgery. If you have unexplained infertility, you should have at least a consideration or a discussion about the risks and benefits of surgery. If you have tried IVF and have multiple failures, you should probably have a consideration of surgery. So it's something you have to discuss with your doctor. You have to determine together what they say. But yeah, I mean, it's just something to kind of consider and discuss and rationalize with your physician, and make sure that you are clearly aware of the risks of the procedure, the benefits of the procedure. In Canada, it's free, but if you're in the US, costs of the procedure, and then make a decision as to whether or not you should go ahead.
Why take estrogen after hysteroscopy and lysis of adhesions? And how soon after can FET meds start?
Wow. So inside the uterine cavity, the tissue that's there is highly estrogen responsive. And if you had scars, and we've cut the scars, which is something I had to do today, then in order to get the lining of the uterus to grow over the scar so it doesn't stick back down together, you want to feed it lots of estrogen so it quickly rebuilds that lining and develops it.
They're asking on TikTok, what kind of a doctor are you?
I know, I saw that. I am a reproductive endocrinology and infertility specialist. So I'm an OBGYN to begin with, and then I'm a subspecialist in fertility and minimally invasive surgery. Yeah.
Hi, Dr. VNT. Would you recommend taking 5 milligrams norethindrone while on a 3-month Lupron and 5 milligrams letrozole down regulation?
You can if you hate the symptoms. It's harmless. So it will reduce your symptoms. We don't, but you certainly can.
Hello, Dr. V and Dr. T. Oh, this is my favorite patient so far.
No, somebody else said Dr. T and V.
Yeah. But this is, that could have been just nice. This is actually Dr. T. Like, this is just full out. You know what?
Yeah.
This is my best friend.
You realize it's more of like a Dr. Dre, Dr. T.
No. It's medical. It's medical. It's for real. Ask me a question. Watch what I do. Put me in a room. Watch what I can.
Yeah.
Watch what I can do.
I can't legally put you in that.
No, well, that's the problem. We need someone to sign a waiver.
Although you did think when you watched the egg retrieval
I could
that
do
you
it.
could do it.
I could do it.
You
I just need feedback. I need to know what that feels like. Like, I need to do it on a like a pretend human, like just to get the feeling.
A virtual egg retrieval.
Just to know what it's like inside.
Yeah, man, you got it.
I don't know what that. You know, or someone's got to say, "Go ahead, T."
It takes a lot of practice.
It's clearly practice.
Yeah.
No doubt in my mind.
Yeah.
No doubt in my mind. So again, hello, Dr. V and Dr. T.
There you go.
Thank you very much.
Yeah.
Does IVF medication, gone on left Menopur and microdose Lupron, affect TSH? My TSH went down to 5 as soon as I started injectable medications during IVF.
Well, that's interesting. So, if your body responds, the estrogen level will go up, and typically your TSH will rise. But keep in mind that the FSH, and if there's any LH activity, they all share the same alpha subunit. So there may be some cross reactivity, but I've never seen that before. So typically your TSH will go up once you're on the medications, but a little bit, not a huge amount. Not down. I've never seen that.
I believe I'm being called the devil by your daughter, so I must deliver the message.
I'm being called the devil by my daughter, or you're being called?
I believe I am. I believe I am. So she says hi. Hi, Baba,
honey.
love you.
Hi, honey.
So I figured I might as well get that out of the way.
How did your shots go, Jay? We should have had. You know what? We should have brought Jenna on the show. She's doing her shots, so we should have brought her on the show. She could have shown everybody how she does it.
Absolutely.
Yeah,
why not?
That would be fun.
Chances of having kids naturally at 38.
Reasonable, as long as you're healthy and he's healthy and your AMH and everything are good. About 15% per month, maybe 10 to 15%. Yeah, not bad. Very reasonable at 38.
What are the chances of conceiving naturally for someone 30 years old with PCOS and adenomyosis?
Well, 0 if you're not ovulating regularly. So it depends on how aggressive the PCOS is. And then if your adenomyosis is bad, that would add further onto making it difficult. But if you're ovulating regularly, you have a chance. There's no way to quantify it, guys. Like the what are my chances questions are great questions, but they're very difficult to answer because I can't do it, on a spot check thing. I need to know all the details about you and then kind of plug it into a mental equation that says this much for this and this much for that, and here's what we would expect for you. And it also depends on, natural, IUI, IVF, all of that stuff. But if you're not regular, if you're not ovulating, your chances are zero. Not to mention it's dangerous and risky. I'm sorry my daughter called you the devil.
It's definitely that devil face going on here. 3 of them even. I don't even know if she's still on to remove it and make angel faces. I don't know what to do with this comment. But she was upset last week. It looks like she holds a grudge.
That's her mother.
Hi, Dream Team. Is vitamin E something we should be taking before an FET? Also, how much iron does PregVit Folic 5 have enough or need additional?
I think PregVit Folic 5 only has 28 milligrams, if I'm not mistaken. I don't remember that off the top of my head. I hope I'm right. But should you take extra iron? Most people need some extra iron, so it's definitely reasonable to take extra iron before an FET. Yeah.
I need somebody on TikTok to push out those 3 devil faces for my own sanity.
Oh,
they're just hanging there. Someone give a comment saying, anything a little bit better than the devil face.
What's with all the plants? I don't know what that's.
That's her name. She's J Plant. I don't know. That's your daughter.
Would I transfer a euploid embryo and a mosaic at the same time? I mean, generally speaking, we only do single embryo transfers. Is there a risk to doing a mosaic and a euploid at the same time? No. So they did a recent study which showed even if you transferred a good quality and a bad quality embryo together, it had no impact on the success rate. So, you can go ahead and do that. It's not a problem.
There we go. Sweet Pineapple says, hello, Dr. Victory.
Hi, Sweet Pineapples. I got... Oh, the next question. Do we do lit therapy? It's just 1T, leukocyte immunization therapy. Yes, we do. Yeah.
Progesterone was 1.6 during a beta when I was 14 DPO and HCG was 24. Progesterone low because of bad embryos or progesterone way too low and possibly the cause of chemical?
Well, that's a really low progesterone level. So, yeah, I would want... I mean, progesterone's low because you didn't have enough. Why you didn't have enough, I'd need to know more about your protocol, but that's definitely a very low progesterone level, for sure.
I'm a big fan of Sweet Pineapples.
Sweet Pineapple said, silly Jenna. Just getting the devil comments coming. Thank you, Pineapples. I don't know who you are, but if I know you, please indicate such so that we can thank you. And silly Jenna. Oh, she must be a friend of Jenna's.
Yeah, there's a gang here.
that would be the best. I would love that. That would be awesome. Yeah.
What? Can you please explain how you build your lining with letrozole after you've downregulated with Lupron?
Yep.
If I won't have a period and don't want to take estrogen?
Yeah, I mean, the letrozole extending for 5 days past the Lupron will continue to stimulate the ovary just a little bit. So we typically get some response. Not everybody is ready, but then you just need like 1 milligram or maximum 2 milligrams of estrase, and they'll thicken. And if they don't, just stop and wait for the next month. So that's the way we do it, and it works really, really well.
Jenna has a TikTok fan club, it seems.
It does, yeah.
We love Jenna.
We love Jenna.
Yes, I am a current patient, but choose to stay anonymous.
Okay.
There we go. Great.
Well, thank you, Pineapples, for being anonymous. That's fine. Love you for getting Jenna booted off.
Hey, Dr. T.
Yeah. Dr. T. Oh, wow. All
right. I don't ovulate anymore.
You want to come see here?
I'm thinking. I'm kind of feeling pretty good about this.
All right.
As I sip on my tea, I'm thinking like this is as legit as it gets.
She doesn't ovulate.
She doesn't ovulate anymore, and I get quote unquote fake periods.
Fake periods?
My doctor said after so many rounds, the body gets lazy. Is this true? Absolutely not. I'll say that for sure. Absolutely. Now the body may need some stimulation or some help to figure out what to do next, but the body does not get lazy. My medical.
Your medical.
This is what they taught me when I went to school. Things may have been different when you went.
So it depends on what you're referring to. If you're menopausal, then it's not a matter of lazy. Your ovaries just aren't producing eggs anymore, and you need that to have a period.
I concur.
But if you're not menopausal, then we would need to know why you're not having a period, because then it's actually risky to not have a period. So it depends on what the problem is.
And your own personal insight into the term a lazy for the body there.
Yeah, I would need to know what the whole lazy part of it.
All right, so
that doesn't make a lot of sense.
Dr. T concurs with Dr. V. Medical reasons why my low BMI has more miscarriage.
Say that again.
Medical reasons why low BMI has more miscarriage.
Organic stress. So your organs are stressed when your BMI is really low, and your hormones are out of whack. So that's why.
There you go. See? I didn't know that terminology, but I knew you got to be.
Your cortisol levels go up. Your adrenergic system is overactive. That's why anorexics have like much higher risks of cardiac, renal complications, stuff like that. Yeah.
Does the long agonist protocol create better quality embryos?
No.
I also didn't think so. No. And
you're full into the I'm a doctor.
You know what? I think it's the tea in the headphones. Somehow it's putting me in a trance. Should I still take baby aspirin if my homocysteine is normal and platelets are good, but I have empty HFR?
Yes, you should stay on your aspirin. Yeah.
Is there a difference between Lovenox and heparin?
Lovenox is a type of low molecular weight heparin. Heparin is just a term. I mean, there is an original heparin, but heparin now refers to just a family of medications. Lovenox is just a member of that family. Although the original heparin was just called heparin.
Hello, Dr. V and Dr. T. I'm
You're totally high on this tonight, man.
I wonder if they can tell. Does IVF medications, Gonal-F, Menopur, or microdose Lupron affect TSH?
You asked me that.
That's
why you gravitated towards that.
Just in case they missed it, Just in case they missed it. For the team. For Team D. Just had a hysteroscopy a week and a half ago.
Okay.
To remove a polyp.
Okay.
Went for ultrasound to start FET.
Yeah.
And there was fluid in my uterus. What could that mean? Going back in a week to see if fluid is gone. Should I be concerned?
You should be concerned. I mean, it could be residual fluid. You could have a hydrosalpinx. You could have an isthmuscele, which is a scar from your cesarean section. They could have had an infection from the hysteroscopy. So, yes, you should be concerned. Not like emergency concern, but concerned enough to want to follow it up and make sure it goes away.
Hi, Dr. V. I watched a video where you spoke about a 1-to-1 protocol for egg retrievals. That is 150 gonal and 150 menopur.
Yeah.
Could you please shed more light on this? And I'm going to let you do it since I wasn't remotely mentioned in this.
Oh, thanks.
Yeah.
We're going to have a Tarek show takeover soon where he does it. It'll be an empty chair because no one ever sees him, but he's going to talk the whole time.
That's right.
Gonal-F 150, Menopur 150 is a reasonable endo protocol. We have all sorts of different protocols for stimulation for endo. So some patients will use a standard protocol, antagonist protocol, adjust the dose based on their ovarian reserve, their height, their weight, their previous history, all of those things. For some patients, we use really low doses because You don't want to get really high levels of estrogen in an endo patient necessarily. So I don't have one protocol for endo. We do frequently use 1-to-1 ratio of what's called a recombinant, which is like either Recavel or Gonal-F. Those are the two most common ones. And Menopur, which is a urinary derived product, because there's an older study that showed that the 1-to-1 ratio increased the number of genetically normal eggs. And I have to say, in our younger patients, we get the same number of genetically normal eggs that everybody else does. But in our older patients, we're like way above normal, which is great. I wish it applied across the board, but obviously there's something we're doing that's doing that. And I think it is the ratio of the hormones that we use.
My clinic won't prescribe letrozole. Yeah. They prefer HRT for FET, but will do natural FET.
Sure.
How can I advocate for myself?
Ask them what their evidence is for doing theirs versus letrozole, and then tell them to review the data on letrozole, because there are now 33 studies all showing letrozole is superior. So they're not reading if they're advocating for doing an HRT protocol over letrozole.
Can you see most fibroids via ultrasound/HSG test? And can I trust I have no fibroids after these two tests and I have no symptoms of them?
Well, in ultrasound, you usually will see all the fibroids. A hysterosalpingogram, which is the HSG, is an X-ray test. You won't see any fibroids on that. They don't show up on an X-ray. But you will see them on an ultrasound.
Does having a first baby naturally with no issues increase my chances in IUI? Conceived 2.5 years ago, currently 40.
Yeah, I mean, the fact that you're fertile means your chances are better. So for sure, that weighs in. Yeah.
I agree.
You agree?
I agree. That makes sense.
Do you want me to check with you from now on before?
It may not be a horrible idea. Just for consistency's sake.
Should I write them down and show you and get a nod, and then we'll go ahead with the rest of
the audience may prefer that.
You guys have created a monster tonight.
You know what it is, eh?
What's that?
Minus dinner.
Oh, did you not eat?
Well, I took a bite, but it was just...
It was quick?
It was super quick.
I woofed down some Subway. It's... Yeah.
Sometimes the problem is there's nothing I can currently woof. I'm unable to woof with my...
unwoofable.
I'm unwoofable right now.
Still
I'm still. Yeah.
When is that going to end, man? We need to eat.
I'm hoping this is the last week.
You said last week it was now last week.
I stagnated. I don't know why. This is a hell of a diet. You eat nothing and you still can't... I recall you mentioning that dieting is about inputs and outputs and calories in, calories out.
Yeah.
So this quote unquote diet that I'm on, they say you got to eat a lot of fatty things.
Yeah.
You got to. I think they're lying. I prefer starvation than this joke of a diet.
Yeah.
Because I don't get it anymore. Like I'm eating nothing but eating everything.
Yeah.
And
are you doing keto?
Yeah, and I'm clearly plateauing.
It doesn't work.
I'm hardcore plateauing.
So Wendy's showing me something last night. She's like, "No, look at this other doctor. She's got 600,000 followers. Yeah. She's an OBGYN. She says there's visceral fat." I'm like, "Who cares about visceral fat? It's just math." And my daughter argues with me about this all the time too. But it doesn't matter what your hormones are doing. Weight loss is math. If you take in less calories than you burn off, it's physically impossible not to lose weight. It's impossible.
If I don't get to my weight, my quote-unquote goal, by Friday, throwing it in the trash.
Okay, good.
I'm missing out.
I want to go back to normal.
Yesterday, my wife made brownies. Yeah. Like the kids and my wife all made brownies.
Yeah.
And I'm just sitting there like an idiot, not able to take a bite. And I don't even know what...
Some? I love brownies.
There wasn't even enough for today. Like they made them yesterday at night.
Yeah.
And they were all gone before school started.
I need to talk to Merv.
Yeah, I told her you should put some walnuts in them. And she didn't. She's like,
oh no.
She's like, who needs walnuts and brownies?
Brownie without walnuts is toast. Forget it.
So a bit of a rant. So
how many of you like brownies with walnuts?
Oh, absolutely. Hands up.
Show some love.
Even in the cafeteria, in the kitchen there.
Yeah.
It's a party of snacks going on in there.
Right now?
Oh, yeah.
I haven't been in today.
Oh, you should see it.
Oh, wow. All right.
Possible reasons to get a heavy period after a second Lupron injection.
Yeah, that patient asked earlier. Probably the Lupron isn't working for you, or you had a cyst. Those would be the two main reasons, I would think.
Jackie on TikTok's asking a wonderful question.
Okay.
Did you end up making those dark chocolate pecan dates last week?
No, we haven't done that.
You know what? Next week. Next week, no matter what.
No matter
what.
Jackie, we will do it next week for you. Yeah. Most optimal time to wean from meds after a successful FET. We don't change anything until 12 weeks. I'm not a believer in adjusting until you're out of the first trimester or very close to it. Yeah.
For modified natural FET, if you have to supplement with a tiny bit of esterase to bump lining, do you need to stay on esterase after the transfer?
Yeah, I mean, it depends how high your lining is. So we have some people where we give them a bit of estrus and their lining starts to grow, and then it gets really thick, so we have to back off again. So it kind of depends on how thick your lining gets, but we try and keep the estrase doses really low, and then we don't have that problem that much. But once you're on, I generally try to keep you stable. So we don't go up and down, up and down. We just want to keep it sort of stable.
A fertile lily cup is a cup you insert after ejaculation from sex. There you go.
Kind of what I thought.
Yeah.
Yeah, that's not going to help you.
It's not going to help.
No.
I believe it won't help as well. What are your thoughts on Plequenil for FET?
Well, that's great for people with NK problems. So if you have elevated natural killer cell numbers or activity, Plequenil is being shown to be beneficial. So yeah, we use it from time to time. I'm not big on Plequenil because we use a lot more intralipids and steroids and stuff like that. But it does work, and there are lots of studies to support Plequenil for that indication.
Have you heard of no menopur high gonadotropin? Only protocol resulting positive outcomes for over 40 patients. One doctor suggested I should try.
So it's a no menopur, just use Gonal-F kind of approach to things.
Yeah.
Yeah, I've heard of every protocol you could possibly imagine. I am a believer that the eggs work better when they get both FSH and LH. And when you think about what your brain does, you are actually producing both. So we believe in using both, and the studies show that the genetic outcomes are better, and it certainly looks like it from our results. But, I'm not hell-bent on protocols. Like, I do believe that there are different protocols for different people, definitely, and different clinics have different skill sets with different, protocols. So I don't think people have to get pigeonholed into this is the only protocol that works. It doesn't work that way. One person will respond to one thing, another person will respond to another. Is there one particular protocol for women that are older? Well, definitely don't use birth control. That's easy. Testosterone, DHEA, human growth hormone. There are enough studies now to support using those if you need them. Not everybody does. Lots of vitamins. That's helpful. And then I'm opposed to doing really high dose stimulation, so we don't. Yeah.
Yep.
Carly's asking a progesterone question. You want me to take that one?
Sure.
Carly's asking if I put my patients who naturally conceived on progesterone throughout their pregnancy also. No, because they're not high risk. So we don't have to. But for patients who have done IVF, we do.
Do you suggest TRT if my husband has low testosterone? It's 362. We're trying to have a baby, and I've had 2 miscarriages, both at 5 weeks. My AMH 13.6 is my anti-Mullerian hormone blood. My B12 is also 1500, very high. Does this affect getting pregnant?
Excessively high levels of B12 are actually associated with autism, but not with failed pregnancy, as far as I've ever read. Do I recommend TRT? If your husband starts TRT therapy, he's going to stop producing sperm. So if you're trying to conceive, you can't use TRT. It will stop sperm production.
I have a question here that I'm very curious
Oh, wow. One you don't know the answer to, Dr.
I think I know the answer, but I'm just curious to actually even see your facial reaction as I read it. Okay. I saw my doctor.
Okay.
I requested warm speculum.
Yeah.
He ran it under warm tap water.
I do that.
Is that normal?
Yeah.
Okay, very good.
Yeah.
Can it cause infections?
No. Tap water's essentially sterile.
Essentially.
Yeah.
All right.
There's a lot of chlorine in tap water.
There is a lot of chlorine in tap water. So that's for sure.
It's essentially sterile.
It's basic. Well, let's not get
it's
into.
Not bleach.
It's not bleach, but it's up there.
It's essentially bleach. So yeah, no, we do that all the time. I mean, there are other ways to warm speculum, but no, it's safe to warm it up under water. I do that in the hospital because there is no way to warm it in the hospital.
Oh, really?
Just turn on the warm water and let it run and then use it. Yeah.
I was very curious.
Because I hate torturing women. Cold speculum is evil.
Is it?
It's just mean.
Yeah.
Tarek had a nice cringe there. Yeah.
Saw my doctor.
Yeah.
Sorry, wrong one. Are we able to transfer embryos to your clinic from the U.S.?
All the time. We get them every day. We got a lot of patients coming from the U.S. So yeah, it's easy. It's not even that expensive. We use a company called Core Cryolab. Core Cryolab. They do a great job, take care of everything. Your clinic just has to contact our clinic and then we do it. We have loads of patients bringing their embryos over because a lot of U.S. clinics just don't listen. It's kind of strange, but the doctors refuse or they say we only do HRT protocols even though it's an endo patient, which just is crazy. So yeah, I mean, we get lots of patients doing that for sure.
We got about 2 minutes left.
Okay.
So I would encourage everybody to put as many likes as humanly possible. And I will have a giant bias towards picking the questions I read out loud.
Can I ask this one because this is a good one?
Sure, Dr. Victory. You can pick the question you like.
How to advocate for laparoscopy if you suspect you have endo? And I think someone asked that question earlier too. So, look, I don't believe people should have to advocate. Like, the doctor should be doing the right thing for you. So if you have an indication for laparoscopy and your doctor's not talking to you about it, then you actually should find a different doctor. But if you need to, for whatever reason, stick with that doctor, location, geography, isolation, whatever the case is, your money's all with them, then you need to just basically say, I feel like I have endo. I don't want to move forward until I've had that checked. A lot of the reason that some clinics, and I'm not naming names, I'm not accusing anybody, but a lot of the reason that some clinics don't want you to go for surgery is because they don't believe that the endo will interfere with their IVF, which is blatantly false because there's lots of data that shows that it does. But more importantly, some of them don't want you to go very much because of the fact that you're going to delay their ability to make money off of you. And so it's a financial loss. And they don't like losing money. They want to make money. So they will say, no, the IVF will overcome the endo. But that's just blatantly not true. So we always give our patients the options. And surgery is always one of the options. For any patient with any kind of infertility, there's always going to be a surgical option. Now, it may not be appropriate for everybody. If you have PCOS, you don't need surgery. But I always tell patients, these are the things we can do to improve your fertility. One of them is surgery. And if it means it's a delay in my patient doing IVF for 3 months, but then they get pregnant naturally, that's a good thing for the patient. It's not a good thing for me financially, but who cares? That's not important. There is no doctor out there doing fertility who's starving. And if they are, they don't know what the hell they're doing. Like, none of us are starving. We're all doing very well. So we should be advocating for you to do what's right. You shouldn't have to advocate for yourself. Tarek just made a lovely little video as kind of an ad for this show, which hopefully we're going to start advertising on YouTube soon. And in that ad, we talk about the fact that we started this show because we hated the fact that you had to advocate for yourselves. We do it for you.
Absolutely.
Me and T.
Absolutely. Hi, Dr. T.
You're so proud of yourself.
Cause it's 9:01 at this point. So
I know. It's been a while since we've gone over.
Yeah. We'll go over today for you if you're in the mood. No problem. What is your favorite part of the job other than being a doctor? The question itself, I love. Other than being a doctor. Well, if everybody really wants to know, It can only happen on this show, you know what I mean? It can only happen here.
This is the best.
This is my new friend.
For those of you who are new to our show, Dr. T is a social media and all things web guru who runs Ibrahim Strategies Group, which is a social media marketing, web marketing, advisory company, and he does all things web, social media, and blogs. He is also on the side an expert in all things water. So if you need water, Tarek is your guy. But and he's a profoundly decent and good human being as well. But he is not a medical doctor. So what's your favorite part of this question?
You know what? I'll give a really good answer.
Yeah,
I'll give an actual good answer.
Yeah.
Me, like many other men, we really know nothing about the female anatomy. Overall, we know, we got the basics down packed.
Sure.
More than that, we're clueless. And I feel I've learned so much. All kidding aside. That I know, like I learned. And I feel it's an accomplishment as a human being that I actually can have, I wouldn't say a deep conversation, but I'm no longer ignorant on the female body reproductive.
You can have an informed discussion or
educated discussion. And I think that's worth a lot. And I can only thank you for that. So that's my favorite thing, that I am no longer your typical classical guy. I'm a little bit slightly elevated. A little bit better.
You see what Carly's saying?
I'm going to hire you, T. There you go.
There was a question right before her.
I'll read it for you.
Somebody said they wanted to ask us a question. It was a very interesting name. It sounded African almost.
Kenzie, was that the one you saw?
No, it was.
It said, "Hi, please can I ask a question?" Ask it. No problem.
Ask it. Go
ask
ahead.
the question. Go ahead. Whoever would like to ask.
Yeah. I love the fact that at 9:00 people start joining us. It's kind of funny.
Well, it's because, we're still here. He's still here.
Still
Great.
Working,
Line it up.
We're still working.
Still working.
Yeah.
A fertility question while we wait.
Yeah.
PCO versus PCOS, and does PCO cause issues with quality of eggs?
There's no difference between PCO and PCOS. And there is some suggestion that it can impact the quality of the eggs. Whether it's the syndrome or the factors that go with the syndrome, in particular high body mass index, that hasn't been figured out yet. But there is some compromise in PCOS women, most likely, in the quality of the eggs.
Hi, Dr. Vinti. Are Prograf and tacrolimus the same thing? Is heparin preferred over Lovenox?
Prograf is sirolimus, and tacrolimus is slightly different. A Italian German hematologist that I know says sirolimus is better, but we can't get it very easily, so we use mostly tacrolimus. And what was the second part of the question? Sirolimus, tacrolimus.
I scrolls.
It was Prograf and heparin and Inahep.
Heparin preferred over Lovenox. Yeah.
No, heparin. I answered this earlier, but heparin is just there was an original drug called heparin, but no one uses that anymore. Everybody's using low molecular weight heparin. So out of the low molecular weight heparins, they're all just a type of heparin, and everybody uses the low molecular weight. So there's Inahep, Lovenox, there's a bunch of them. Fragment, you can use whichever one you like. It doesn't make a difference.
How do I keep my uterus hospitable after finally treating ureaplasma and other bacterial infections?
Probiotics, and stay away from whatever got you infected in the first place.
So, to indulge into my own knowledge, like eating yogurt, is that?
Yogurt is good. Bioactive yogurt.
And
then if you get the plain kind, you can actually stick some in the vagina.
Interesting.
Yeah.
Yogurt.
Yeah.
Wow.
Yeah.
I learn something new every day here. I'm telling you.
Yeah.
Can you use Orilissa to expend Lupron/letrozole suppression if transfer delayed because of chronic endometritis? Thank you.
Yes. Sure.
Um,
I got a quick one here.
Go for it.
Are my chances of getting pregnant after my IVF baby higher or still the same as before IVF? They're higher.
They're higher.
And then Carly asked if I have a favorite pair of scrubs. I do. I have no idea who they're made by. But I have these big black scrubs which are really comfortable and they've got pockets everywhere and they've got zippers and I love those. I also have figs. The figs are quite comfortable as well. So yeah, either of them. Does Dr. T ever get in front of the camera?
It's inevitable.
We're working on it, but he hasn't yet.
It's got to be a good reveal. It's got to be a good reveal. It can't just be like, "Hi, I'm on the show. Hi, I'm like," that's no good. We've kept it a secret this long.
You're like the Stig.
It needs a whole thing.
You are a
full production.
Yeah.
Can you use Orilissa to expend Lupron letrozole suppression? Okay,
yeah,
great.
That was the last one.
What do you think of the AMH being 13.6?
Yeah.
I read that over 4 is considered high. I'm 36 years old and do not have any children. Does this increase my chances of having twins or triplets?
Oh, is she talking 13.6 nanograms? That's like the highest I've ever heard.
Yeah, she said, and she read that over 4 is considered high.
So that would be nanograms. Wow, that's like a stratospheric AMH level. It doesn't change your chance of having twins, but you might have PCOS. So make sure you talk to your fertility specialist, but naturally having a high AMH is not associated with an increased risk of twins.
They're calling me chicken. Not sure about that comment.
It says it reminds you of Wilson.
Yeah,
from
Home Improvement. There's a lot of mystery going on here.
That's awesome. Oh,
this is really a great show.
Thank you, Dr. Victory and team. I'm currently 5 months pregnant with my thanks to all of you. You're very, very welcome. Yeah.
Absolutely.
Oh, pregnant with my first boy. That's so cute. I love it.
How long do you need to do PIO after a medicated FET cycle?
12 weeks. Well, we don't do medicated, but 12 weeks. Yeah.
And does assisted hatching help for over 40 patients, or should it implant more naturally?
It's one of the most controversial issues in fertility. We hatch almost all of our embryos. In fact, the other day the girl said, "This one hatched naturally." I was like, "What?" Because we never let that happen. But the studies are equivocal. Some studies show no benefit. Some studies show a benefit. Some studies show it in specific groups, like older women, thick zona, that kind of thing. It's hard to know. I don't know of too many fertility centers that don't hatch the embryo, so we do. But
I'm just scrolling through Instagram. There's so many questions. And I'm just trying to find something.
Okay, we'll go 6. It's 9:10. 5 more minutes?
Okay, 5 more minutes.
I'm on call tomorrow.
Yeah, no worries.
I'll be here for egg retrievals at 6:30.
Where do you get your bagels from for Bagel Fridays?
Tim Hortons.
There you go. Simple question.
Who knew that?
They remembered from last week. You brought that up last week.
Did I bring up Bagel Friday last week?
You brought it up for sure. Yeah.
Yeah, we just got them from Tim Hortons. Although, admittedly, I'm a little frustrated with Bagel Friday because we don't get enough cinnamon raisin bagel, which is the only bagel worth eating.
Oh, you're cinnamon bagel guy?
And then we fight for them.
Oh, really?
Yeah. And then they know that if they take mine, I'll end Bagel Fridays.
Absolutely. They should know.
Because
I
need my bagel on Bagel Friday, right? But it's like a race because, and then I walk in and you just see people get deflated because...
the good ones are gone.
I got to get Mara to buy more cinnamon raisin. But then, some people like the other ones too. It's weird.
I'm a big fan of the cheddar jalapeno.
Really?
Oh, yeah. I like that.
Oh, see, I need cinnamon raisin or bust. Yeah.
Or bust.
You know what was really good? Do you remember when they had those French toast ones? It was like the maple bagel.
Maple bagel.
Oh, those were good.
That was good.
With just some butter.
All I do is butter. I don't do cream cheese. I'm strictly butter.
Yeah, no. cinnamon raisin toasted with some light cream cheese.
You know,
Great breakfast.
oh, the cinnamon raisin toast.
Yeah.
Also very nice.
Also very nice.
Also
yeah.
very nice.
Yeah.
I have to say.
Carly says, "Oh my God, those were the best ones." Yes,
Yeah, they were.
That's
Absolutely.
right, Carly. They were awesome.
If someone has stenosis in their
Yeah.
cervix
Yeah.
with PCOS,
Yeah.
and all the tests come back good, besides those, do you think IUI would be a good option for them?
Oh, for sure. Yeah. IUI or just have someone stretch open your cervix. We do that all the time.
Question. I just heard about Zymo and its excellent results from someone today. Is this typically more effective than ICSI and IMSI? Thanks.
No, not even close. So you can use Zymo before you do ICSI, and we do routinely for all of our patients. I'm still not convinced it makes a difference, but we do use it. But it's not even close to being as effective as ICSI. It's like an add-on. It's not a replacement. We've got a very interesting comment here
Okay, go ahead.
from a lady named a lady, or well, it looks like a dude, but it's a lady's name, Ambrose. Fertility in women is largely dependent on adrenal health. Even doctors' education doesn't teach you everything. Yeah, that's not actually true. So you have to provide evidence for the stuff that you're saying. I need you to demonstrate a study to me that shows that fertility is largely dependent on a woman's adrenal health. There's no question that the adrenal hormones and the adrenal milieu is important in your hormonal well-being and balance and so on, but fertility is not largely dependent on a woman's adrenal health. That's categorically not true, and a huge generalization. So we like to make sure that if people are saying stuff here, that they're sticking to scientific facts.
Hi, Dr. V and Mr. T.
Oh, you got a mister.
I think I'm almost offended.
You've been demoted.
I'm
dude.
almost offended.
Yeah,
But I'll read it because it seems like,
it's a good question.
it deserves.
Okay.
When can you retest the biopsy for endometritis after Lupron suppression? Lupron Depot from July to the 30th of September, last shot. Thank you.
So first of all, no one should be doing biopsies for endometritis. It's useless. The inter-observer variability in assessing endometrial biopsies is so bad, it's the same as flipping a coin. So pathologists don't even agree on what constitutes endometritis. So don't bother. It's a waste of your time and money, and it's horribly painful. But if you're rechecking, whether it's via biopsy or just blood sample collection, menstrual blood sample collection for PCR with your next period.
Reasons for premature rupture of membranes and how to avoid it next pregnancy.
Infection would be number one. Smoking, drug use, exposures, trauma, weak cervix. Those are the main ones. But smoking is huge. You cannot smoke if you're pregnant. Marijuana as well. And then the other main reason is infection. It is 9:15, dude.
All right, whatever you want, boss.
Kelly says, challenge accepted.
Yeah, because you basically had shots fired at Ambrose there.
Yeah. Nix, what's the reason for chemical pregnancies? Oh, God, man, if I knew, I would be happy. I have no idea. No one knows why we get chemical pregnancies. The main reason is going to be genetics, hormone issues, environment, infections, your genetics, your partner's genetics, sperm DNA fragmentation, egg quality, sperm quality, endo, the list goes on and on. Funny shape to your uterus, polyps, fibroids, all that stuff. Okay, I gotta go.
How about this one more question? Because this guy's like, I asked my question. Like, I want people to understand, because this is important. This is important. We have 4 or 5 different platforms that we're streaming live on,
and
right?
roughly 5,000 views per show.
That's right. So I do my best, guys, to get all through the questions.
Yeah, but it's impossible.
But it's impossible.
Right.
So, disclosure.
This guy gave you like heck.
He gave me the stink eye.
Okay.
So let's give him his thing so he has it, so he's happy.
Okay.
Final question.
Yeah.
Don't even know if I can read the words here. Let's see.
Okay.
Does Ehlers-Danlos syndrome
Ehlers-Danlos syndrome.
have any impact on getting pregnant or staying pregnant?
I don't believe it has any impact on getting pregnant, but pregnancy with Ehlers-Danlos is risky because you have weakened arterial walls and you're at high risk for aneurysm. So you need to see somebody before you get pregnant when you have Ehlers-Danlos syndrome. It's not just a go get pregnant. And we're done. All right. Carly says she's just my favorite patient, so I read her. Sorry, guys. All right, guys. Hey, wait. I'm his favorite patient.
It's a battle.
That's from Kelly. Okay, ladies, no fighting. So have a wonderful evening. Love you all. And I hope you guys all have a very nice evening. Lots of wonderful fertile thoughts to everyone. And my own little monkey in particular who's doing her own thing these days. So lots of love to you all. We will see you next week. What's the date next week? That's not December. No. It's too early for that one.
Next week, I'll tell you.
It'll be the 28th. Yeah, it'll be the 28th.
28?
Yeah.
You sure?
Well, 7 days from now.
Okay, yeah, that's right. 21 plus 1, yeah.
So we will see you next week on Fertility Fact or Fiction. And I'll talk about the fact that we were wrong. So, yeah, watch that show. It'll be exciting. Have a good one, guys. Take care. Thanks for watching. Take care. Bye now.